Hi, this is Dr. Toby, your host on Health and Wellness with Dr. Toby, inviting you to watch our show this week. We have a phenomenal guest, Dr. Ovayoza Adeleye. Grew up in Nigeria, trained in Nigeria at the University of Ibadan for medical school, went to Brookdale Hospital in New York for her residency in pediatrics, and recently at the University Hospital Cleveland completed a fellowship in child, adolescent, and adult psychiatry. She's lived in different parts of America, in New York for 5 years, in Maine for 2 years, and then moved down to Louisiana. Now she's been here for 14 years, and she lives in the Natchitoches area and runs a hospital, a clinic with her husband. And she's going to be sharing with us her heart about pediatrics, her heart about psychiatry, and how she has combined being a mother, a wife, a pediatrician, a psychiatrist, a daughter, a sister, so successfully. She's also an author of a new book that followed a traumatic experience where she had an accident in 2010. You don't want to miss her story. Jesus is Lord. Amen. I'll hold it. Hi, this is Dr. Toby, your host on Health and Wellness with Dr. Toby. Thank you for joining us. We have a special guest. Our guest is Dr. Ovayoza Makoju. She's a child adult psychiatrist trained as a pediatrician in New York, and she's currently working at multiple sites. The address is on the screen. And we want you to know that she's been in practice for more than 20 years. Started at the University of Ibadan in Nigeria, went to Brookdale Hospital for her pediatric residency, and did a fellowship after that to become a child adult psychiatrist. I believe at the, was it Cleveland or?
University Hospital in Cleveland, correct.
University Hospital Cleveland. And she's here to talk to us about what she does and how she does it. She's a mother, she's a wife, she's a psychiatrist, she's a pediatrician, she's a woman of faith, she's an author. She just authored a book called Spirit Over Flesh, talking about her journey of faith after she had a life-threatening car accident while visiting her family and relatives in Nigeria. So you're welcome on the show, Ovayoza. Thank you for coming.
And thanks for
We've
having
been trying
me.
to have you here for a long time, but COVID wouldn't let us. We're grateful for coming all the way from Natchitoches.
Correct.
Thank you so much. So how are you doing? What's going on in your world of, how did you make that transition from pediatrics to psychiatry? The reason I say this is because you did that over 40.
Correct.
You went back to school, did a 3-year resident fellowship, really a residency,
You can say that
in
again.
your 40s. What people would consider, I call it mind over matter. They think my body can't handle it, but obviously your mind could handle it.
Correct.
So how did you do that, shuttling between here and Cleveland and keeping in touch with your academics and maintaining a stable family front, a financial front? Give us because I'm saying this because a lot of my viewers want to do things. They want to go to nursing school, they want to go to art school, they want to go to designer school, they want to go to computer school, and everybody keeps pushing it away, keeps delaying. So what was the genesis of this transition you made?
Well, I think the first thing I always say, well, thanks for having me first. You know, we've been trying to make this happen. I'm glad we finally, nailed it down, and here we are. And I think the main push or drive or motivation here has to be the passion one has for that desire. That desire, you have to achieve that goal. And I don't really refer to this as a transition. I believe I'm doing more of the same thing. Because working as a general pediatrician in a town that's somewhat rural, Natchitoches is a really small town.
Like 20,000?
Well, if you put the environs in, surrounding parishes or towns that use us also as a source for primary care or medical care, because we do have the Natchitoches Regional Medical Center. So we're somewhat like a central location. So we might serve a population of up to 50,000 people. But you're right, this town itself, probably around half of that will be in Natchitoches itself, within city limits. So providing pediatric care, we all know is, diagnosing, treating illness, preventing illness in children. We usually go with the age range 0 to 18. Sometimes we extend to 21, especially when you're in a rural area and there's less access to care. what I discovered is, we do, physical health, wellness, as well as behavioral health, even as general pediatricians. However, it does get to a point where, the severity of the mental illness or children who suffer from severe emotional disorders, a general pediatrician might not be as well equipped or well trained to kind of provide
Handle that.
evidence-based care. So we had to refer to outside sources. So access to care might take them an hour or more to get there.
And that's here, Brentwood.
Typically in Shreveport, or Alexandria is also a nearby
Okay.
town. Not, Alexandria does not have a child or adolescent psychiatrist. Many times adult psychiatrists can improvise. They will take care of children, usually from the age of 6. So, kids 0 to 6, there was a gap there. As well as the access to care, having to wait months to get out there to be seen. So we ended up having to fill that gap. So I was pretty much doing a lot of behavioral health, even as a general pediatrician. And I guess that's what motivated me to, if I'm going to do this, then I want to do it right.
Wow. So the training equipped you over 3 years, am I correct?
Correct.
To be a child, adolescent, and adult psychiatrist.
True, yes.
Wow, that's fantastic. So give me a background. What I knew you when you were in the University of Ibadan. Dr. Ovioza was one of the smartest people in her class at the University of Ibadan, and she won't say that, but she was extremely intelligent. She went to the University of Ibadan. She went to Queen's College, one of the premier high schools in Nigeria, and she's always been a leader. And when you were in the University of Ibadan, what caught your fancy in terms of practice?
Well, I guess, in Nigeria, there's pretty much not that many professions as children we all aspire to be. But I always had the desire to want to help people and heal people. So I'd always want to be a physician. And I didn't necessarily decide what kind of physician I wanted to be until I went into med school. And then I really, that my desire was to work with children.
Okay.
That's why I felt I could reach people, the population who really couldn't always advocate for themselves or express themselves necessarily.
Wow.
So I always wanted to be a pediatrician once I, decided for sure I'm going to be a physician. I'm in med school. What specialty am I interested in? And that's what I decided.
Awesome.
Pediatrics.
So tell us a bit about your journey and your joys in pediatrics and now psychiatry, because I've noticed a lot of people, they give up on the journey because of the pain on the journey. They don't go the whole hog because they want to get immediate gratification. Now, you've had pains, but I know there's some joy. So tell us the journey and the joys along the journey, because we don't want to just talk about the pain, the struggle, the turmoil, the terrible outcomes. We know people have died, you may have lost patients, but I want to know the joys of practice on this journey that you've had as a pediatrician, as a psychiatrist, as a physician in Nigeria. I think you probably worked maybe 1 or 2
Correct.
months, right? Or years. I don't know if you worked.
Yes.
Oh, you did? Okay.
Well, I would say mostly as a house officer.
Right, right.
If you want to say I was employed and paid.
Okay.
So I worked a year as a house officer in University of Ibadan.
Okay.
Before I left Nigeria and went to the UK. And, unfortunately, yes, we do have a lot of brain drain from Nigeria. I will say, being, I guess, younger then, very optimistic, feeling like, the whole world is opening up to you and you can pretty much be where you want to be. And I'm not going to say it was the challenges in Nigeria that forced me to want to leave or seek my profession elsewhere. I will say it was just the kind of, I guess, wanting to know what was available out there and reaching out to kind of make the world a playground and just be where you want to be or where you felt you could get the best kind of training you felt you needed. So I ended up staying in Nigeria for about a year. It was a challenging year. And then working in a university college hospital in Nigeria where there was not always, you could say, the level of care you wanted to provide was limited very much by what people could afford to pay for, as well as what we had available on ground. So working there in pediatrics was challenging. What was the joys was, making do with what we had available and still having great outcomes despite that. No question there were losses, but I would say, the joy is more just the fulfillment from being able to do what you love to do. That's why you have to be passionate about what you the kind of profession you go after. You really have to have a desire to.
So this was in your 20s.
Correct. This was in
Okay.
my
So you
20s.
graduated, got married in your housemanship year.
Well, I kind of graduated right there in about 1999, and I would say maybe January. I got married in 2000, so a year later.
Okay.
So by the time I got married, I was in the UK.
In the UK, okay. So what did you do in the UK for those 2 years? I presume you were there.
Correct. So while I was in the UK, I was mostly taking licensing exams, the United States medical licensing
And we
exams.
met there as well. Both
That's
of
where
us were doing our training there
I
together.
think we did that together. And I did take the British licensing exams as well, although since I kind of did them simultaneously, I ended up moving right after that to the US, which is where I started residency.
Wow.
So I
So you
did.
got into residency from the UK,
Correct.
and you got into the Big Apple, New York City.
Correct.
Obviously, you had family, friends in New York when you landed. Am I correct?
A few friends in New York who were very supportive. It takes a village. So
Because that was your first time in America, right?
well, I'd come in a few times, to interview,
interview.
and to kind of, visit a few places while I was seeking to be employed. That was mostly what brought me to the United States.
Did you practice at all in the UK?
Not as a physician.
Okay.
I worked in I worked as a phlebotomist at the
Okay.
time, and as like an EKG technician
Nice,
at the
nice.
time.
What was your experience in New York like?
New York was, pretty much residency training, so that was all time consuming. It was a very busy,
Busy time. You had
inner
2
city
kids
hospital.
by that time.
I actually arrived in New York when my daughter was about 3 months old.
Wow. Wow.
And then that was in 2002. And I worked at the Brookdale Hospital in Brooklyn, which is an
a
inner
trauma
city
one
hospital.
center. Yeah,
It's a
very
trauma one.
busy, very busy.
Very busy hospital. So you could say training there was intense, but it was definitely worth the while.
I came to visit you when you were in residency, and I noticed your house was opposite the hospital.
Correct.
I was like, don't you want to get away from the hospital?
It was pretty convenient to walk across the street. I didn't have to drive or catch a train, so it worked for those 3 years, and pretty much that was most of me and
Just
New York,
hospital, home.
95% of the time, except for maybe groceries.
Oh my goodness. Then you left there and went to Maine,
Correct.
worked there for 2 years.
I worked in Maine for almost 2 years.
Wow,
Yes.
wow. And then moved to Louisiana.
Yes.
And you've been here for how many years in Louisiana?
In Louisiana, about 14 years now.
14 years, awesome. I raised 3 children and made a mark in the community with Shalom Clinic. So tell us a bit about Shalom Clinic and what it does, because that's where we have your address on the screen.
Oh, nice.
So if people call Shalom, what do you guys do at Shalom Clinic?
Okay, so Shalom, we mostly provide primary care, and it's general pediatric care, until I more recently, last year, started to practice behavioral health. So we do
Okay.
psychiatry as well.
You like the word behavioral health. It like feels better than psychiatry.
Well, psychiatry, I think, is the stigma related to that.
They think all psychiatrists are shrinks. I know they've said that, but it's not true, obviously. 'Cause
Well-
I know you.
You might want to, what do you see shrinks to mean? That
I
might
have
be
no
where
idea
I need to start
what
from.
what the meaning of the word shrink is actually.
But the reason we use behavioral health, it might be more the stigma related to psychiatry. But I am a child, adolescent, and adult psychiatrist, you're correct.
Okay.
But when we say behavioral health, it kind of takes away the stigma, and it might cause people to be a little bit less apprehensive about seeking care. So we tend to use that term interchangeably.
Okay. But you were talking about Shalom. What does Shalom do?
Shalom, right now, we do provide general pediatric care.
Okay.
I'm doing less of that now since I'm also doing behavioral health at other sites and other locations.
Okay.
So my husband, Dr. Olusegun Adeleye, he's the general pediatrician who's on site, usually 5 days a week. I'm there 2 to 3 days a week doing general pediatrics as well as child, adolescent, and adult psychiatry.
So if people want to reach you, they can call the number on the screen and get an appointment
Correct.
and get any support systems they need. In your 1 year as a psychiatrist, what has the joy been? I know it's been like a year, right?
Yeah,
Okay.
right about
Tell
that.
us a bit about that, because you said it's not a transition, but obviously you're not seeing as many pediatric patients as you used to.
Sure.
You're getting used to the adult world.
Correct.
Drugs, alcohol, bipolar, schizophrenia. Now, somebody will say that is not joyful. Somebody will say that is traumatic to pediatrician who she should just see nice, cute babies all day long.
which is fine. That's fine too. But the truth is, children do have these disorders, and it's tough when you find kids who have needs and those needs are not being met. The other thing is, I'm in a better position now to actually prevent some of these disorders because I'm more informed, and I'm aware how important it is that in in childhood and adolescence as well, you get the support you need to make you resilient and less likely to develop these psychiatric disorders when you're older.
And I know there are very few child psychiatrists in America. There's,
Correct.
I would guess, less than 1,000.
Well, probably somewhat more than that, but Louisiana, definitely there's a shortage
Okay.
of child and adolescent psychiatrists. And unfortunately, they're mostly located in big cities, which is probably where there's a larger population.
Okay. So at the moment, we have child psychiatrists in Shreveport at Brentwood,
Correct.
and then you operate out of the Rains,
David Rains
David
Community
Rains
Health
Community
Centers.
Center.
Yes.
And then any other place, Monroe doesn't have one that you know of, maybe?
Not that I'm aware of.
Okay.
I know.
Shreveport, probably New Orleans, Baton Rouge.
Oh,
might have.
definitely.
Okay.
Lafayette as well.
And Lafayette.
Correct.
Okay.
And even in different locations in Shreveport, apart from Brentwood, LSU does have some child adolescent psychiatrists.
That's true. The residency they may rotate in Monroe too.
Correct.
Tell us a bit about what your average day in the life of a pediatrician plus psychiatrist. Give us an average day in your life, because the reason for this show was I looked around at a lot of my patients in the area, and I said education is the missing key. The Bible says, God says, I wish above all things that you prosper and be in health as your soul prospers. And a lot of the deficit is just lack of information. So what I want to show them that there are people in medicine who can bridge that information gap. And one of them is a psychiatrist and a pediatrician. So tell us what the average day in the life of a pediatrician and a psychiatrist looks like. So when you start your telehealth, what kind of diagnosis do you see on your telehealth for a day, for example?
Okay. So like obviously it varies, and there's so many ways to practice and integrate care and do both pediatrics and psychiatry. The way I choose to do it is I do alternating days.
Okay.
So some people might choose to do mix up the day, but I might do like a Monday and Tuesday I'm doing psych or general psych, and on Wednesdays and Thursdays I'm doing pediatrics. So I separate it. And then, my typical day when I'm at David Rains, I do a lot of telepsych since the pandemic. We've had to improvise. And that's been working out pretty well.
Okay.
And with individuals, not every psychiatric patient is suited for telepsych. But those who are more higher functioning and more social and educational academic functioning, they are able to keep up with that. For those who have severe mental illness, many of them have to come in person. So I'm pretty much running my schedule, starting off 8:30 in the morning, and running through the schedule. Unfortunately, yes, we do have a few no-shows. I do find that with telepsych, the show-up rate is much better. So we're able to reach patients. I think the access to care with telepsych, you don't need transportation. You just need to pick up a phone call. That has actually improved the no-show rate. So I'm running through my schedule until I get a break at about lunchtime. I'm pretty much providing whatever care is needed. We
So
also
what kind of diagnosis are you seeing?
majority of our diagnoses will be depressive illnesses, anxiety, generalized anxiety, social anxiety, as well as in children separation anxiety, and social phobia, agoraphobia. So there are many anxiety disorders. I think the pandemic might have also contributed to increasing the rates of anxiety in this area.
So what's this thing about Mississippi, Louisiana being a high risk for cocaine, crack? They call it, I know
Crack.
it's not the right word. I don't know the right word. Can you help me with that?
So you're talking about the substance use disorders?
Yes,
So,
in babies.
and
yeah.
with children, so much what has been ongoing is the opioid epidemic.
Right.
And what we're finding is now there's medication-assisted treatment that's been helpful. And in fact, pregnant women have access to care that they have access to, naloxone, buprenorphine, Naltrexone. Well, we now mostly do while with buprenorphine treatment, that's been very helpful in kind of staving that pandemic. So a lot of, I guess the primary care from obstetricians is where these are picked up.
Right.
Once they do a drug screen that's positive, pregnant moms will be referred to addiction treatment and medication-assisted treatment. So that's been very helpful during pregnancy. And what we hope is once the pregnancy and the baby is born, yes, some kids will have withdrawal, and they do have to kind of get some specialized care during this period. But once that's passed, the mothers hopefully will remain in treatment, and from being pregnant might also, stay
Is it
in
high in the
remission.
state of Louisiana?
It's been high in the state of Louisiana. I think there's
Okay.
been a countrywide I don't want to call it a epidemic
Outbreak.
or outbreak of opioid use disorders, but no question that that's been a big issue also in the state of Louisiana.
Wow.
And then with the cocaine use, interesting enough, and crack cocaine use, more recently, there's been less of that in my own scope of practice.
Wow.
And what I've been seeing more is individuals with chronic pain who were at the time on opioids and then eventually started to seek drugs off the street. So the opioid pandemic is what's been more prevalent
Wow.
recently.
So what happens to those babies with substance use disorder? We don't treat the babies with buprenorphine. We treat the mothers. Am I right?
Correct.
So the babies are simply just detoxed. They're monitored. They're watched. There's no immediate psychiatric intervention at birth.
Correct. So
obviously.
not necessarily psychiatric intervention. There might be some less stimulation. Let them have some less bright lights or just kind of calming care and meeting them at their needs. We don't necessarily have to put them on medication, but yes, some kids will have some withdrawal, and we pretty much just necessarily do some as needed care until they're stable enough to go home.
Tell us a bit about this book in the last 6 minutes we have. Dr. Vioza wrote this book, Spirit Over Flesh, in 2013?
Correct.
Okay. So it's published by Westbow Press, and it's available online if you go to westbow.com. And if you want to reach out, her phone number is on the screen. It's on wherever good books are sold, Barnes and Nobles. So give us a little bit of a background to this.
So Spirit Over Flesh stemmed over my own, I guess when you have a passion and you want to express it, sometimes writing is the best way to do it. And during this time after I had my car accident, and that was in 2010. Okay. So I was unfortunately in a ghastly car accident in 2010 while I was visiting Nigeria with my family.
Ghastly means somebody died.
Well, let me say those who did die might have resurrected from the dead.
Okay.
It wasn't too bad, but I did get severely injured.
Okay.
So I suffered a femoral fracture as well as a hip fracture, and required multiple surgeries to kind of treat that injury that I sustained during the car accident. I also suffered a severe concussion and several other injuries that were not as serious.
Wow.
So after that, I had a long-term time for recovery. So it took me about 2 to 3 years to get all my surgeries completed. During that time, I had a lot of time on my hands. Unfortunately, I was unable to work for half of that period. And I had the time on my hands to follow another passion, which was the writing.
Wow.
So I was able to write the book during that period.
Wow. I thought it was called Mind Over Matter, but you corrected me and said it was Spirit Over Flesh.
Same idea.
Okay, but what's the reason for the title? What's the reason for Spirit Over Flesh?
Well, Spirit Over Flesh, I felt is a struggle that we all face. And I actually targeted this book to meet more of the population I serve, which is more children, adolescents, and maybe young adults. And I felt, as they're coming to your adolescent years, there's a lot of, pull out there to seek and things that one might desire. And in America, there seem to be, a lot of people do have the freedom to explore and determine exactly which way they want to go in life. Wow. And I felt my children were getting into adolescence at this time as well. And fortunately, I do feel that religious foundation has to be there, not just as they become adolescents, but from childhood. Mm-hmm. So that already was pretty much a part of their life. Wow. So I felt this would help guide them and kind of maybe answer some of the questions they had to ask as they started to decide which way do you want to go in life. And the sacrifice that it takes to be a Christian is what I felt I wanted to most address.
Oh, wow. Wow. So Avioza is a mother of 3 children, a wife, and pediatrician, and a psychiatrist. My question is this: if you were to do everything again, what would you change? You're in your mid-40s. I'm sure you heard of this myth they call the midlife crisis that men have, but I don't believe it anyway. Some people are like, oh, maybe I was born to the wrong family, maybe I was. So just looking at your life, are there any regrets? Would you do I mean, this is a learning experience. Somebody watching might want to know from your experience and vintage point looking backwards, are there things you would have done differently? Maybe you would have gone straight into psychiatry if you knew. You wouldn't have done pediatrics. So those are my thoughts. Are you a person who thinks maybe I should have done this, maybe I should have come straight to America without going to England? Maybe, things like that.
I'm not the kind of person who thinks that way.
Oh, really? Okay.
I think I'll pretty much do it all over again. If anything, I might do it even better.
Even better. Okay. So whatever your hands find to do, just do it with all your might.
Well, I believe in divine providence.
Okay.
I believe I'm exactly who I'm meant to be at this present moment, sitting in this exact chair where I'm supposed to be at this
That's
point.
good.
I believe there are many destinations to reach the goal, or I do believe in making the most of every opportunity and every moment. And I don't believe in, of course, looking back to right wrongs is not a bad thing, but looking at the past to kind of, be depressed about it or
Criticize
critical, as long as it is in a way to kind of set goals and move forward.
Move forward,
So
right.
that's the way I see my past.
What would you talk to a young girl, 15 years old, trying to get into medical school to be a physician? In the society we live in, some people believe there's a racial discrimination against African Americans in the medical field. They've looked at the statistics and said that there are less African American males, not
Correct.
females now, males, in 2020 than there were in 1970, if you go by the geography or the proportion. So what would you say to that young girl who wants to be a physician and looks at you as a role model? Can you give her any pointers to achieving her dream?
Oh, definitely. I'll say you can do this. And first step is just believing in yourself that you can. And the second step is being ready to do the hard work. Take on that hard work and give it all you've got. Put in the effort that entails. So it's going to be a lot of sacrifice, and having the right mentors to help you set you on the way to reaching that goal will be essential. And I don't see any reason why any young female or male who's African American or otherwise cannot reach this goal if they're prepared to work hard. We have to be realistic as well. You have to have the passion and the desire. You also have to have the ability to kind of understand and be intelligent enough. The academic knowledge that is required, it's a lot of work.
Right.
So as long as you are ready, I believe it can be done.
Wow, that's awesome. So this is Dr. Toby Moma, faithandpower.online. Check us out. We have a couple of books, Healing Lives, Praying from the Altar, my new book, Spirit of Acceleration. Check them out on faithandpower.online. Join us. Our Holy Ghost night is in Monroe, June 25th, Friday night. Looking forward to seeing you. We're going to be praying and believing God for special miracles from Acts 19, verse 11. The venue remains Oyo Hotel on I-165. Look forward to seeing you there, time 11 p.m. God bless you. Jesus is Lord. Amen.